Hello, I'm Agnes Rodil, an ICU nurse at Kaiser Permanente. I'm here today to talk to you about an article that I read in Vox last March 31, 2020. As we know, Vox is a liberal learning American news and opinion website owned by Vox Media and is noted for its concept of explanatory journalism. The article, The Grim Ethical Dilemma of Rationing Medical Care, explained, written by Romeo, talks about the guidelines for rationing scarce resources deeper by state, though many assign rankings based on a patient's odds of both short term and long term survival, wherein the federal government has not yet released official recommendation for the COVID 19 pandemic. But difficult moral questions about how to allocate scarce medical resources have received extensive consideration from both philosophers and doctors. And it's been the subject of rigorous academic study among bioethicists. For instance, a systemic analysis of moral principles of allocation and how doctors can help to decide whom to treat first. The ethical dilemmas posed by the coronavirus are real world examples of deep moral questions philosophers have studied for centuries. For instance, the world's most famous living utilitarian philosopher and a vocal proponent of effective altruism, Princeton University's professor Peter Singer said, "There's always a scarcity of resources in medicine, but situations like this make it particularly clear." As he favors a utilitarian approach that considers multiple factors, the life of expectancy of patients, some types of adjustment for quality of life, and perhaps the patient's ability to help others. In this article, I have identified three bioethical principles. First, the principle of justice. Justice in healthcare is usually defined as a form of fairness. This suggests the fair distribution of goods in society and that we examine the entitlement role. Second, the principles of beneficence. The principle of beneficence, which can be seen as a healthcare provider, have a duty to be a benefit to the patients and that positive steps are taken to prevent and remove patient harm. Lastly, respect for autonomy. Respect for autonomy, where the patient is able to act intentionally based on their own understanding without controlling influences, and that is against their free will. This article is significant in my profession because this pandemic only highlights and uplifts the vital role that I perform in healthcare. I have witnessed the many different ways that I can contribute, change, and take the lead. As the number of COVID 19 cases continues to spike, American healthcare workers will likely to face agonizing decision on how to ration care. That's why for now, self-quarantine and social distancing are moral decisions I can make. How bad the triage will be depends enormously on the behavior of the ordinary personnel. The only way to solve these current issues is through massive social collaboration. The code of ethics for nurses is clear. The necessity to allocate scarce medical resources does not mean that all such rationing is ethically justifiable and that a justifiable rationing decision in one healthcare system may not be similarly justifiable in another. Perhaps the impact of the problems, issues, and the difficult decisions that healthcare organizations make may be alleviated by utilizing imaginative but rational strategies, such as what you are seeing right now, the process of running SRAT for COVID 19, to finance, organize, and deliver care when the resources are scarce. Decisions related to scarce resource allocation must be made considering the ethical principles of autonomy, beneficence, and especially justice. Ethical issues related to scarce resource allocation is likely to become even more complicated in the future. It is, therefore, crucial that healthcare leaders diligently and ethically continue to explore these issues. To conclude my presentation, rationing of healthcare is necessary, unavoidable, and ethically challenging. The levels at which healthcare is rationed and the transparency of rationing are essential structural considerations in creating a sustainable and fair healthcare system. Ethical rationing entails careful choices guided by just, reasonable principles, and fair procedures. How rationing happens is important because it is not only affects individual lives, but also reveals what values are most important to society. We live in a world in which need is boundless, but resources are not, and medicine is not immune to the consequences of this reality. I really appreciate you for taking time to listen to my presentation. Thank you.